patient comes in and they tell you that they have shortness of breath. Here is a list of some of the things that I might ask them. This is not an all-inclusive list. There's several other things, but these are just some things to get you thinking about different diagnoses that might be going on that could be causing this potentially. But just remember, there's always a lot more questions, but these are great questions to guide. In addition to your old carts, you can use some of these questions as well. So let's begin. Number one, leg pain. It's always a good idea to ask an individual if they have any kind of leg pain or redness. This could indicate that they have a DVT that turned into a PE. So I guess we could add here, we could add PE, not DVT. And then also asking them questions to see if they have any risk factors for this, specifically like if they've had recent surgeries, if they're on oral contraceptives, if they have any comorbid conditions, if they've been on long trips or recent travel, like they've been sitting a long time, they haven't been really moving their legs, and then also if they've had any long or extended bed rest. Number two, if they've had any kind of recent upper respiratory infection, this might be a sign that they potentially have pneumonia. You could ask some other questions like if they've had any wheezing, or if the patient doesn't know what wheezing is, you can ask them if they have a whistling sound in their lungs. Also, any kind of fever, coughing, chest tightness, chest pain. Upper back pain is a big one that often gets missed as well. Number three, orthopnea. So when they lay down, are they getting more short of breath by just simply laying down? A lot of these individuals will complain that they're not getting very good sleep because they're having to sleep up in a recliner, and they can't lay flat. This could be an indication of CHF. These individuals often have other comorbidities and they have history of heart issues. So that would be an important question and past medical history to establish. You might want to also ask them if they have had any recent weight gain, leg swelling, and then number four, chest pain. All of these things, obviously, you could have chest pain with, but myocardial infarction, this is always one that we want to make sure to ask about, questions that are related to this potentially. Once again, asking about comorbid conditions, any kind of past medical history of heart conditions, and then if they've had any left arm pain or any jaw pain, if they have any feelings of doom, impending doom. Sometimes in females, they'll often have just nausea, they just won't feel right. So it's not always necessarily chest pain that they'll have, but be aware of that as well, that a lot of times females present differently with myocardial infarction. I hope this helps, and write down any questions that you think you might add in addition that may indicate another diagnosis that you that can match with certain questions. And once again, this is not an all-inclusive list, but these are some questions that I would definitely want to ask my patient coming in with shortness of breath.